Diabetes. Today in the clinic, we're going to be seeing 3 different patients with the 3 different types of diabetes.
Hi, I'm Jess. I have type 1 diabetes.
My name's Beth and I have type 2 diabetes.
I'm Michaela. I'm pregnant and I have gestational diabetes.
Here we have Jessica. She is the 5 to 10% of diabetics who have type 1 diabetes, and this is when the pancreas does not produce insulin. So, Jessica, what's one thing you can't live without?
My insulin.
This is Beth. She has type 2 diabetes. Type 2 diabetes affects 90 to 95% of diabetics and is due to poor lifestyle habits such as poor diet and exercise. Fatty!
2.
This is Michaela, and she has gestational diabetes.
I'm 34 weeks today.
So exciting. Boy or girl?
Girl. Oh my gosh! Okay.
Gestational diabetes affects 2 to 5% of pregnant women, and it usually disappears after pregnancy but can come back later down the road, and it is caused by an enzyme in the placenta.
Hi Jessica, welcome to the UVU Dental Hygiene Clinic. Thanks. First, I'm going to start by going over your health history form. I see that you checked that you're diabetic. Can you tell me more about that?
I have type 1 diabetes.
Great. I'm going to ask you a few further questions. Do you monitor your glucose levels, and how often do you do that?
Yeah, I do it about 6 times a day.
Great. And what were your most recent glucose levels that you took this morning?
It's about 65.
Great. And how are you feeling this morning?
Great.
Okay. No lightheadedness, dizziness? No. All right. And have you eaten anything this morning? Any breakfast?
I have my breakfast.
Okay. Awesome. And do you experience any problems with your eyes, feet, or legs?
Nope.
Great. And do you see your physician regularly?
Absolutely.
Awesome. We're going to keep that in mind as we go through our appointment today to prevent any medical emergencies. Here are some strategies that we're going to implement during Jessica's appointment to make sure she stays safe today. First, we're going to schedule her appointment in the early to mid-morning, preferably right after they've had breakfast. We keep appointments short and concise, and I instructed Jessica previously that she should keep her normal dietary intake prior to the appointment. We'll check her glucose level before beginning anything, and if she's feeling not well at all, we'll stop treatment and test that again. We're also going to have frequent recall and prophylaxis appointments. We're going to use topical fluoride, and that's it.
Okay, so there are 3 types of diabetic emergencies. The first one is diabetic ketoacidosis, otherwise known as DKA. And DKA is not a common occurrence within the dental office, and the patients at risk for this are the patients who have poorly controlled diabetic habits.
The first step of treating DKA is recognizing the signs and symptoms. Some of the signs and symptoms are warm, dry skin, and a fruity odor on breath, tachypnea, thirst, and muscle weakness. After you identify the signs and symptoms, you want to evaluate the level of consciousness, place the patient in a supine position, and activate the CABS of CPR. One of the most important things in treating DKA is obtaining the blood glucose level. If you are unsure which diabetic emergency a patient is experiencing, you can always provide glucose. This will not significantly harm a DKA patient, and it will significantly help a hypoglycemic patient.
The second type of diabetic medical emergencies is hyperosmolar hyperglycemic non-chaotic state, which is when patients will be hyperglycemic and dehydrated. This is not a common occurrence in the dental office, but those affected will be neglected, institutionalized, or mentally deficient diabetic patients.
The third diabetic emergency is known as severe hypoglycemia or insulin shock, but that's kind of an older term. This happens when your blood glucose level is below 40 to 50, and it affects about 30% of diabetics. This happens because you either missed a meal or you don't have enough insulin, and that can be because you started hitting the gym and you didn't up your insulin.
Okay, some signs and symptoms of hypoglycemia include confusion, dizziness, fainting, weakness, and it can also include cold and clammy skin. And if it gets more severe, it can lead to a seizure, which will eventually lead to a coma.
Oh no, it looks like Jessica is experiencing hypoglycemia. Michaela, I need you, we have a code purple. I need you to go grab the glucose from the emergency kit, please. Jessica, I'm gonna sit you up.
I'm gonna go grab some glucose from the medical emergency kit. I got some juice, which is glucose.
Okay, so we have administered 20 grams of sugar through the juice that we gave Jessica. Made sure to secure her airway, and we're gonna monitor her vital signs now, and we should be seeing a positive response within 10 to 15 minutes. So we were looking for that positive response within the 10 to 15 minutes. Unfortunately, we did not get that, and Jessica is unconscious. So, what do we do in this situation? So, Jessica still is unconscious. I'm gonna stay here with her, but Beth, I need you to contact EMS immediately.
Calling EMS.
So Beth has contacted EMS and they are on the way. So what I'm gonna do now is I'm going to maintain her airway. I'm gonna make sure that she's okay and that she's breathing. I'm gonna administer oxygen, 4 to 6 liters a minute, and I'm gonna monitor her vital signs. And I'm also gonna have Michaela administer glucagon intramuscularly, 1 milligram.
I got the glucagon from the emergency kit. I'm gonna administer 1 milligram intramuscularly.
I'm EMS and I'm here to save Jessica from diabetes.
I brought the glucose. I brought some juice.
Thank you. Jessica, I'll have you sit up for me if you can.